Standing or seated in front of a mirror, side bend your neck as though bringing your ear toward your shoulder. Be very careful not to allow your shoulder to tip as you side bend your neck and head. If you have normal range of motion, you will be able to side bend your head between 25 and 40 degrees. Start by sitting upright in a chair, maintaining good posture. Be able to keep your shoulders and back against the chair. Rotate your head to the right and to the left. You should be able to rotate at least 70 to 90 degrees in both directions. 90 degrees of neck rotation is achieved when you can rotate your head until your chin lines up with the seam of your shirt as it runs over your shoulder. If you are age 60 or more, 70% is the norm. The body test is used to determine if the muscles that lift the shoulders into a shrug position will resist neck rotation if tight. They also assist in maintaining optimal position of the shoulder joint during movement. To test the length of these muscles, first perform the neck rotation test to assess your range of motion. You then place your arm around a partner, making sure to completely relax the arm muscles in your arms and shoulder. Rotate your head away from your relaxed arm. Switch arms and repeat the test on the other side. The aptly stretch test is used to assess both internal and external rotation of the shoulders. This is a two-part test. First, reach over the shoulder and attempt to touch the top inside corner of the opposite shoulder blade. This is the test for external rotation. Then reach behind the back and attempt to touch the lower part of the opposite shoulder blade. This tests internal rotation. The ability to reach behind the neck to touch the top inside corner of the shoulder blade indicates normal external rotation. Normal internal rotation is indicated by the ability to reach behind your back and touch the interior angle of the opposite shoulder blade. To perform the test for tightness of the pec minor and major muscles, lie on your back with your hands behind your head. Allow your arms to drop towards the floor. Normal pectoralis range is when the forearms lay flat on the floor. If both forearms do not lay flat on the floor, your pec minor and major muscles are tight and need to be stretched. Lay on your side with the hips flexed to 90 degrees, pulling your knees up towards your chest. If needed, place a towel or pillow just big enough to maintain good neck alignment and place the pillow or towel underneath your head. You will extend your arms out in front of you, placing your hands together in the outstretched position. Keeping the knees together and in contact with the ground, take the top arm, keeping it straight, and start to bring it up and over your body, causing rotation through the lower back and your T-spine. The goal is to see if you can maintain knee together position and knees in contact with the ground as you open up your torso and lay both shoulder blades back on the ground and your top arm extended and lying on the ground. If you feel tightness or tension through the back, the shoulders, or the spine, go only as far as your body allows. How far over you get will be measured, and this will determine the pass or fail of the test. The supine knee extension test is used to assess lower hamstring length. Lie on the back with both legs extended on the floor. Be sure not to lift your head off the floor during the test. Lift one leg. Stop as soon as you feel intense pressure on the hamstring. The goal is to try to have your legs at 90 degrees with the leg completely straight. Bring the leg back down and repeat to the other side. The goal is to hit 90 degrees on each leg and compare the right to the left side. Waiter's bow test. The waiter's bow test assesses the length of the upper hamstrings and their ability to allow normal motion at the hips. To perform the test, stand up straight with good posture and take a pinch of skin at the low back directly opposite your belly button.
Hold the other arm out like a waiter serving wine and bend forward with the knee locked straight. If you have normal upper hamstring length, then you will be able to bend the trunk 50 degrees forward at the hips while holding the pinch of the skin, maintaining a curve in the lumbar spine. If you do not have adequate hamstring length, then you will not be able to bend forward and maintain your lumbar curve. The pinch of the skin will be pulled away from your fingers. The cigarette butt test is used to assess the flexibility of the internal and external rotators of the hip. To perform the test for the internal hip rotation, stand against a wall with your feet hip width apart. Imagine you are putting out a cigarette with your right heel by rotating the leg outward, pivoting off the heel. As you turn your leg outward, make sure your pelvis does not move and that your leg is locked straight. To test the length of external rotation, rotate the leg all the way inward in the same fashion. Make sure your pelvis stays square to the front, not rotating. Normal interior hip rotation will allow you to rotate the foot outwardly to at least 45 degrees. If you have normal length external hip rotation, you should be able to rotate the leg internally until your foot is inwardly rotated to at least 40 degrees from the starting position. Side bend test. The side bend test is used to assess spinal range of motion in side bending. Stand with your feet together and your heels, glutes, back, and head against a wall. Keeping your back, head, and shoulders against the wall, slide your hand down the left leg. Go as far as you can without the right heel coming off the ground. Perform the same procedure to the opposite side. Avoid flexion and extension of the torso. If you have normal range of motion in your side bend, you should be able to reach the joint line of your knee on both sides equally. The arm raise test will assess whether or not you have tight lat dorsi muscles. The arm test raise is performed by standing with your heels about 1 foot from a wall. Your butt, back, and head should all be resting against the wall. Have a partner stick his or her hand behind your low back of the wall to determine approximately how much curve you have. Raise your arms in the air and bring them forward towards the wall. Then have your partner reassess your lumbar curve. If you are able to bring the arms towards the wall without the curve in your lower back increasing and the back moving away from the wall, you have passed the arm raise test. The thoracic extension test is performed in much the same manner as the arm raise test. The thoracic extension test indicates whether or not there is adequate extension in the thoracic spine to protect your shoulders from injury during a golf swing. To perform this test, start in the same position as the arm raise test, with your heels about 1 foot away from the wall and your butt, head, and shoulders against the wall. If your middle back does not extend adequately and you are unable to rest your head against the wall, you will need to improve your thoracic mobility. The Mackenzie press-up test is a mobilization exercise developed by New Zealand exercise specialist Robert Mackenzie. It is used to determine the golfer's ability to extend the lumbar spine. To assess the ability to extend your lumbar spine, lay face down on the floor with your hands placed outside the top of your shoulders. Next, inhale deeply and begin pressing your upper body upward as though you're doing a push-up, but keep your pelvis on the floor. As you push your body upward, exhale. While performing the Mackenzie press-up, it is important to relax the glutes and spinal muscles. It is also very important to exhale as you push your body upward, as this facilitates lumbar extension, making the movement easier. If you have normal spinal extension, you should be able to straighten your arms and keep your pelvis on the floor.